People think that the fertility is just reproductive organs. It's not. Fertility, it's entire system. So if the gut is inflamed, so will be reproductive organs. If woman says, well, everything is okay, the only problem is I cannot get pregnant, no such thing. It's impossible. So if you don't have enough money in your account and you want to withdraw, you're not going to withdraw more than your bank can give you because it's going to be credit. Woman either does not get pregnant, she might get pregnant and miscarry. This is payback because no soul wants to come into this world knowing that it's not safe.
Welcome back to the 5R method. Fertility is often treated like an isolated problem, but what if it's actually the most powerful reflection of your body's health? Today, we're stepping into a topic filled with hope, emotion, and science the deep connection between your gut, your hormones, your energy, and your ability to create life. Let's dive in. Dr. Marina, we're back again.
Thank you for having me. It's always a lot of fun doing this, and I'm here to share my knowledge, my expertise, my experience, what I learned over the years working with patients who are dealing with fertility that is not an isolated. If somebody's struggling of conceiving and carrying to term, because women have a lot of different issues, right? They can get pregnant, they cannot get pregnant. They get pregnant, but be scary. So what's happening in their system? Why they're not able either to get pregnant or they cannot carry? There are lots of people that's coming forward with either one, and those that do miscarry, they miscarriage the time of expulsion. It's different gestational age, meaning the first time week 14, second time week 12. Like this means something, and people don't understand that. Once body learns this, there is a reason for that. And how, what can we do, and what do we do to make it all better, make it go away, correct it so they actually can do what they want to do, grow their family.
And it's such a prevalent problem right now, and so many people are trying to figure out, how do I fix this? And we think it's usually just isolated to our reproductive organs, but you know it's so much more than that, which I'm so excited to dive into more today. But you say that it's not so much a problem, but a signal. What does that mean? What are those signals saying?
So if when patient come, male or female, and they say, you know what, if it's a female, I cannot conceive. I hear and understand certain thing. Most probably thyroid is not working, adrenals are not working, inflammation, mitochondria, which is a powerhouse, a cell, is not working. So understanding that's a systemic approach that's necessary. It's not just reproductive organ. Gut is not working to correct all of this and help these people receive what they want, achieve their goal.
What are some of the misconceptions that people might have about why they can't get pregnant, both men and women?
People think that the fertility is just reproductive organs. It's not. Fertility, it's entire system. It actually starts with the brain and connection. We call it HBO, a hypothalamus, pituitary, thyroid, and ovarian for male. It's testicular. It's communication from the brain to testicles, or from brain to ovaries. We need to make sure that this communication is viable. If communication is not viable, there's no communication. If brain is not able to communicate to part of the body and simply signal to do something, and body does not follow, we need to create an order of things. Everything should be in order. Very important. And this is, I think, biggest misconception. People don't understand it. Everything in the system works in beautiful harmony, and we have to recreate that harmony. Reproductive organ, women and male as well, are in pelvic cavity, the same place where the gut is. So we also have fluid in it. So if the gut is inflamed, so will be reproductive organs. And again, people don't understand that. If one says, well, everything is okay, the only problem is I cannot get pregnant and my husband is healthy. Maybe she has an autoimmune condition. The immune system, the system that's huge in a body, does everything to prevent that for specific reason. Maybe she doesn't have proper amount of energy. Mitochondria is completely worn out. It's not enough energy to create that embryo. Let's not forget, we need so much more energy because the egg itself, it's highly dense organ with a lot of mitochondrial cells. So we need energy for division, and creation of the embryo. This is just step number one. What about creation this beautiful being, a human body? So much more work necessary. So if this woman is already worn out, not much in her system, how her body gonna create that? There's no raw material. As I tell patients all the time, do you have raw material to do this? I have people who are very health conscious that come to me, and women exercise all the time and they look specific way. There's a beautiful, beautiful muscle mass. They're very lean, no fat. We need proper amounts of fat, adipose tissue for normal hormone level, such as estrogen. Like we need all of these estrogen, progesterone, testosterone for reproduction. If you don't have proper balance of those, it's simply not going to happen. So for normal balance of hormones, you need proper working digestive tract because all hormones become available and bioavailable through the gut and liver. You see, like we're going back again. Thyroid is so important. Maybe thyroid is not working, we're underactive, maybe it's overactive. You need to bring it, you're either activated or regulated. It depends what they need. Everybody has specific addressing that specific need specifically.
And those are a lot of different moving parts and a lot of things that we need to have firing the right way. And like we talked about on our past episodes, there's stress, there's energetic blocks, there's just the craziness of running around day in and day out that can really upset and kind of get our system out of whack. So, how can a woman who is intending to get pregnant, perhaps as a later pregnancy in her 30s or 40s, prepare her body in a healthy, functional way so she can be hopefully as successful as possible?
Again, looking and talking about 5R method, right? We need to reveal first. We need to understand what's not working. Firstly, very important to understand in order for all this beautiful mechanism to work again, we have to go through steps, understanding what's happening, what we need to do, how we need to replace, what we need to regulate, how we turn everything and optimize everything. Of course, a lot of things people can do by themselves without even having any kind of provider. Make sure you're sleeping well, make sure you're resting, make sure you're eating well, make sure you're not under eating, don't over exercise. Exercise is important, don't overdo it. Because when you're overdoing it, whatever energy you have stored, you're using it towards exercise. The same as with chronic conditions. And people thinking, the age is biggest factor. No, it's not. We are aging faster when we're getting more depleted. If we're nutritionally dense, then our aging is prolonged and we can live our life more active and enjoy what we're doing for so much longer. That's why anybody who comes and they are in their either early or mid 40s, I explain to them wellness comes first and everything will follow. You cannot treat, and again, we spoke about it, treat reproductive organs only and expect a wonderful result because it's not just reproductive system that's in play, entire body is in play. Unfortunately, what I see now that women are much younger coming with this same problem. So if the age would be the only factor, I wouldn't have patients in their early 30s coming and they're menopausal or perimenopausal. So there is no energy. Their mitochondria is empty. We need the fuel. We need the powerhouse.
That's
Absolutely. Yes. It is reversible and it's very much provable. And this is what I see in my practice. I have all different kind of people coming with different problems. There are some people coming that already did IVF and failed and come back. There are people who are now considering IVF and maybe they're looking into, I want to improve the effect of IVF if I absolutely have to do it. We are here and I guide them through this very beautiful pathway and I explain to them when we do this reveal stage, first step, I explain to them, I show them the results. I was like, I'm not surprised why your body's preventing. So when we do blood work, I check for sex hormone binding globulin. So it's a protein that released out the liver that signals the body either reproduce or not. So if the sex hormone binding globulin is high, body knows that there is no fuel. So in order to make sure this woman is alive, it stops reproduction. It's a protein that releases out of the liver that signals the body we either yes, go ahead, we're gonna do it, or no, we're not gonna do it.
not open for business.
What business? You don't have resources for yourself. Barely. I do very specific energetic testing for these patients and I tell them how it feels. I show it to them. I have very beautiful lady came through. She's in her early 40s, although she's experiencing menopausal symptoms, the hot flashes and all that for years. So when she came, she's also in fitness. She's very fit, beautiful. It's very interesting the way that you feel to me. Your energy is all around your core. there is no energy around your reproductive organs. Nothing there. For usually, if I see this, there is no energy. And I told her a couple of things to do and what to avoid. One thing I told her, don't over exercise because she is an instructor. She's a yoga instructor and all of that. And 2 weeks later, when I saw her and she joined the program, she said, it's amazing. I reduced my workouts and no longer had flashes. See, yes, we do tell patients that exercise is important. But if you have somebody whose road is so depleted and they keep exercising, not servicing themselves, they're actually hurting themselves. Everything should be at balance. Before you do something, we have to make sure that they had energy in reserve. You're not depleting and you're not dry of that energy.
It's obviously so important for the woman's body, who is carrying the baby, to be in the right shape with all the right levels. But you're one of the few clinicians who takes male fertility very seriously as well. What are you seeing with why male fertility is declining, and what's going on with the guys right now?
All the same thing that's happening with the women. So now what we're seeing clinically, the levels of male fertility decline the worst, and the lowest testosterone levels and the lowest sperm counts. Deficiencies, toxicities, they worn out. The nutrition is not all great. Not enough movement a lot of time. Lots of men have very sedentary jobs. The name laptop should never be on your lap, okay? Because here is a reproductive organs and EMF is there, and phone should not be in a pocket. Like it's a lot that goes in it. And I do have a lots of men that come. It's either they come by themselves or their wives bring them because, in order to make a human being, you need three. I don't ever say two. It's husband, wife, and dog. We want to make sure that emotionally, social, emotionally, everything is okay. They have good relationship and they start physically working with them. And it works. I also have now quite a few male that came through after testosterone replacement therapy. What it does to male species, it actually, if the testosterone level high enough, it turns off this axis and they don't make sperm. It sterilizes them.
What are some of the root causes? What are the things that are causing us to get to that point, or causing men to get to that point, that low sperm quality count?
Not enough nutrition. They're very toxic. There are plasticides everywhere. People don't rest enough. We are now such a worn out nation. Age, younger versus older means absolutely nothing. Younger patients are as sick as older people are sick. It's crazy. I haven't seen this about 15 years ago. It was not like that. It was, what conditions are prevalent to people of certain age. And we knew it's like, oh, you're in your mid 50s. This is, we see this. Now we see the same thing in people who are 23 years old, and 25 years old, and 32 years old. The disease is becoming much younger. And there is a reason for this. And that's why we talk about wellness altogether. But like, of course, when people are not well, their fertility will be affected. That's why when we talk about fertility, it's a sign of well-being. So they're not well, the fertility will show accordingly. So in order to improve fertility, we have to do the base work, find out what's not working. You're deficient, let's fix the deficit. Let's make sure that you have all proper nutrition that you can detoxify. Like it's your house, it's your home for your soul. Is it clean enough? What about your thoughts? That's very important. Psychosocial and psycho-emotional. Did you have any kind of emotional trauma? Did you address this trauma appropriately so it doesn't affect your fertility? We are not just body, we are a vessel. And a vessel functions with very specific frequency. It's absolutely amazing. It's amazing work. I love it.
Do you see more people who come on as to you as like a first line of treatment before going to IVF? Or do you see just as many people who perhaps are frustrated with IVF that are like, there has to be another way? Talk about the difference between those two. And perhaps the people who go to IVF first, you might know, is it never going to work because the root issues are still not firing the right way within them?
Yeah. So both ways. I have the group that comes after IVF has failed, and I have a group that's searching. They know they have a challenge. They're looking for answers before. So usually these are the people who are more educated and looking for answers before they do, and they understand how body works. So the patients that I see after IVF didn't work and they come to me, usually they have certain physiological problems. What I see after IVF, their physiological problems already gotten worse. When I met her after she did 2 rounds of IVF, I couldn't recognize her at all. She presented very differently. She told me she's an influencer. So the way she presented before, physiologically, physically, was very different. It was a different woman. that's now gained about 100 pounds. She's like, I feel like my body is very inflamed. I'm always in pain. Everything hurts. Everything aches. She's like, I almost eat nothing and I'm still gaining weight. And she tried Ozempic. She's like, it's weird because I did Ozempic, it didn't work. I simply stopped gaining weight. I didn't lose anything. So when we did blood work, at that moment, she already had autoimmune condition that she didn't have before IVF. And I'm not saying IVF does this. No, it was so traumatic for her. She overcome this, and when they have specific traumatic events, other things happen, they follow, and then imprints on the system. So interestingly, she also was diabetic. Her thyroid was not working. Like everything fell apart. So within 6 months, we undid everything. The Lyme's disease. So her system completely corrected everything, calmed everything down, regulated everything. She's absolutely thriving individual right now. She is in such a physical state right now. She never was like this until 20 years ago. So she presents beautifully. She has this beautiful glow. Body is amazing. Yes, people get sick, but with right approach, we can correct things and then it functions very well. It's absolutely amazing. So for those people who come before IVF, of course, their body is not in a great place, but they didn't go through such a hardship. Think about it. If somebody cannot conceive already, they're inflamed, they don't have proper amount of hormones, they don't have proper amount of energy. We go to process of IVF. So how it works is maybe the provider recommends few supplements. It's two or three, CoQ10, zinc, and something else like multivitamin. That's it. And then they go through very specific ways of stimulating your hormonal charge. So they get injection of progesterone. It's very specific. You did some things and then you forcing this body to put out. So what's going to be the out? Like you gave a little money and now you want to squeeze. It's almost like a banking system. Like you don't have enough money in your account, but you want to withdraw. So if you don't have enough money in your account and you want to withdraw, what you want to withdraw? You're not going to withdraw more than your banking give you because it's going to be credit, right? It's going to be line of credit. It's not going to be the money that belongs to you because you have to pay back. So when one system does not have enough energy and you're constantly forcing, it have a negative feedback loop and it usually doesn't work. Woman either does not get pregnant. She might get pregnant and miscarry. This is payback. If her system even went through the pregnancy, usually complicated because you don't have resources. So in order to change this, you have to change everything. You have to deposit a lot before you withdraw. So you have some left for entire 9 months. It's 40 weeks of gestation where this woman going to use this energy within a month. It's not just, if people don't understand, to carry a child, it's 24 hours a day without break. If the system will take break for 2 to 3 minutes and there's no circulation to fetus, it's finished. You see it like it's very specific process. And I explained it to my patients and they're like, oh, well, now it makes sense. For those people who didn't go through IVF, if they have specific reason and they still have to, not a problem. We prep them because everybody has a different condition. We prep them, we make sure the body fed, everything regulated, they feel great. They gotta feel great. If patients don't feel good, then work was not done. They physically have to feel certain way. They feel it. Oh, I wake up in the morning, I have so much energy, I do not know what to do with it. I go through entire day, I go to sleep and I'm not tired, but surprisingly, I still fall asleep. And my sleep is great. When I wake up, I feel even better than before. Like this. You understand the body now is ready. The person is now ready. And then it's either happens by itself or if they need to do IVF because we have a lots of single women who want to experience motherhood without a partner. They don't have a boyfriend. They want to have a child. So they're still going to go through IUI or they're going to go through IVF because that's how it's done. They don't have a physical body that will help them with it, right? That's that. Parenthood is different for everyone. But again, it's a beautiful process for male, which is very interesting. So I have very, very nice patients, and I have a male client who came onto the program because now it's their time to build their family, and it's not happening. And they found out that this lovely gentleman has no sperm. He was on very long therapy of testosterone, very long and very high for other goals. So it actually had a negative feedback loop where the brain says, well, you're getting it from outside, you're not going to produce it. And our poor testicles, they freak. I ask him, what's the size of your testicles? You examining yourself. And he's like, oh, they're very small. That's what happens with prolonged use of testosterone with higher dose. We know this. Anything that's used for enhancement of the male physique, the muscle building and all of that, it's turning into testosterone anyway.
The supplements that they're taking now, the pre-workout, all those things, can that contribute to it as well?
So pre-workout on everything that they're using usually converts to estrogen, by the way. It's the other form that's not great. That's why you can see men in the gym and they have big chest. So that's estrogen. And his stomach is a little pudgy, they present very specifically. So he's now in the program for 3 months. And I spoke to him last week and I was like, so how's it happening for you? Tell me how you feel and all of that. So everything now it's in accordance of his biological age and his has descended. Now they're bigger son because now they're functioning as it should be. He should be making his own testosterone. He should be making his semen. I have another young woman that we onboarded and she's very proactive and she understood if you want your pregnancy to be good, you need to be prepared. You need to find out if your is good quality. Why don't you just take some kind of test? If you don't do it, find somebody who'll do it for you. So he did it and he has no sperm, zero, another individually. So this is happening because people are not educated. It is very sound. Everything should be in balance. Yes, you want to grow your muscle mass, wonderful. You can have some testosterone. Don't go over, and that's why you have doctors for this. So it is safe. And these patients should be open with the doctors and stating that in whatever time period I will planning to build my family. So that is preserved, not turned off. It's like jeweler's work. It's very precise. First, communication from the brain to the testicles has to start working. What specific nutrition should be given.
I've heard stories from my friends who have said, oh, the guy's sperm isn't good or their swimmers aren't strong and they're doing IVF. But is that not something that's discussed in IVF offices, how to increase that? Because it seems like that's almost a roadblock that you're solving for that can be reversed. That seems from the conversations that I've had, something that's just kind of like, well, it's just the way it is.
Kelly, when you're going in a store, for example, you're going to a store to buy lingerie, you're not going to the same store to buy jewelry. So when individual goes to IVF clinic and they say, you know what, we would like to, work on building our family and we're having challenges and supposedly my husband is okay, the wife is okay. And still doctors will do testing and to them it might be okay. And doctors will do semen analysis and say, they will say your semen is enough for IUI or IVF. They're not going to be discussing it's not good, it's too much, too little, fast enough, slow enough. No, this is enough for this process. And they're going to use this for that process. As again, when you go into the store to buy something, you're not buying something else. People don't understand. Yes, you went for IVF, but what you're passing along to your child, your cells, the energy and the program that passes to the child is your program now. It's the program you're running. Meaning, if you're inflamed, then that's what you're passing along because that's what's going through, right? The same thing for men and women. It's the same thing. So if you want a better quality of offspring, for example, if you want healthier child, the ideal situation, you want to be healthy by yourself so your child is healthier. You don't want to be doing this. For example, like, if you want to plant an apple tree. If you want the fruit, you want a big fruit that tastes good, that smells good. So you're going to find a seed of an apple tree that has very healthy seed, right? So when you're seeding that seed from healthy tree, that's what you're going to get. A male, a woman, and a man that are together and they are not well. They're inflamed, hormonally, they're not okay. They have lots of issues. And that's their seed. You put these two things together. What's expectation? We are living in a world where everything is created by God. And the formula is the same. If you want better outcome, the seed should be healthier. It is not very difficult to understand. Some time ago, I remember this woman reached forward and she said, oh yeah, I would like to have another child. She had one already and she was all over the place. She's not very healthy. And I told her, I was like, listen, we need to do some work so you have a better chances of having child that's brings more in sense of health, epigenetics, genetics. She's like, oh, but my I didn't do any of this and my first daughter is okay. Can you elaborate? And I was like, so what does kind of mean? What kind of is like, what is the problem that she's having? So she says she's extremely overactive. It's mom telling me she's extremely overactive. She also has chronic bowel issues. She's like, okay, you see, now we live in society with these chronic issues became normal, but it's not normal. And I told her, I was like, listen, do you want to have another child like this or even worse? Because then you were younger, obviously you didn't have so many issues. Or your choice is to have much healthier child. You know, it's all up to you. They don't realize that it's so important to understand.
Okay, so for someone who is listening who could feel overwhelmed or discouraged, or I've been feeling like I'm doing all the things, but nothing's working, what's the first step that they could take to begin improving their fertility, or someone perhaps who's considering it to begin with that now maybe doesn't feel their best? They're like, wait a minute, this opened my eyes. I need to get a move on.
Sure, absolutely. So, number one, if you have a guide, somebody who understands your physiology, because if you're not trained, you're not doing it, how would you know what needed for you? So, instead of wasting time and wasting resources, money for supplements that maybe not working for you, maybe they're causing more inflammation, get somebody in your team, because whoever that is, it's a doctor or whoever medical provider that has done this kind of work for a certain amount of time, has expertise, has experience, will be your teammate. It's one team that will guide you and explain to you what's necessary and what steps are necessary for everybody. We need to reduce inflammation, whatever that means to you. Most people, inflammation comes from food. That's why we correct the digestive issues. What they have to make sure they eat something that doesn't cause inflammation. Because if you eat whatever, it causes inflammation and you're taking the best supplements, it will never work. So having specialists that knows exactly how to guide you will get them on proper way. Everybody should be sleeping proper amount of hours to rest. Everybody should be hydrated enough. Everybody should be nutritionally dense, not deficient. And every system should be able to clean up. So normal functions of the body are supported. Having a provider that can guide this individual, I think the most important part, it's most important piece. Schedule the one you found. Speak to this individual. Does it feel like this doctor or this provider hears you? Do you understand each other? This communication, this connection is very important.
It almost seems like people perhaps take getting pregnant or fertility for granted, like it's just something automatic that's supposed to happen. Like the person that you're supposed to be with forever, the relationship should be easy. Instead of, like you said, having the coach, understanding the difference in when a body is good, when a body's bad, when a relationship needs help. Everybody needs a coach. But to your point, and I think what you've been stringing throughout all of these episodes, Dr. Marina, is that our lifestyle, simply by just where we are evolved as humanity, is really, it's positive in so many ways, but it's a detriment to the natural workings of the human body.
Absolutely. So now our norm is again, women work more than two jobs. Also, women are now very well educated and the CEOs of the companies, and so lots of stress. You know, and when I speak to my patients, like, you stressed out all the time, it's not good for you. And answer that I hear, it's funny. Oh, I don't feel it. It's okay.
Because it's normal. It's like standard operating procedure.
Yes, but reproducing system, it's not okay because your system is not gonna replicate in a fight or flight. Doesn't work like this. In order for body to do something, they have to create specific environment. And that's why I educate my patients. We need to create an environment where your body thrives, when it knows there is no harm and knows that, it's safe. Because no soul wants to come into this world knowing that it's not safe. Think about it. Would you want to come into this world knowing it's not
No.
safe?
No, there's enough horrors here.
It's a lot that goes into play. So, of course, every time that I start interacting with an individual, I want to make sure this individual firstly understands. So we understand each other. It's not one way. So this person needs to understand what I'm saying. And I also do my best to understand this individual. We communicate. The connection is very specific. And I explain it to them. If they are not guidable and not coachable and don't understand the messaging, it's going to be very hard. It's not going to work. And also giving that space and opportunity for patients to digest this information. A lot what I'm saying, they never heard it before, so it a lot to take in and it takes time. And we always tell them, it's like, listen, you have your time, think about what we discussed, see how you feel. If an individual feels a specific way, which is it causes a lot of resonance, you say, you know what, maybe it's not right time for you. Take your time. Wait until it resonates right so you understand the entire process and you understand how to address it. Once it comes to you, they're available to help you. And all of these people are back. They're all back. You don't lose them. They come back because it takes some time for them to understand this information. It's a lot of information. So today's episode 4, and you're speaking about this, and you are with me all the episodes, and you hear something new every time. It more in. What about these people that are, coming for consultation and they speak to me first time? See, it's a lot to take in. It's a lot to understand. And my staff are very supportive. We support our patients every step of the way. And fertility, it's so complex. It's not simple. So a lot of things have to, and we coach our patients. We have different kind of patients. We have patients that don't observe any kind of religion, that they can do whatever and whenever, it's not a problem. We have some menstrual cycle has to align with certain days. So we do all of that as naturally as possible so they don't lose time. Has menstrual cycle and ovulates, we say 12, 11, 12, 13 times a year. A woman who has polycystic ovarian syndrome, for whatever reason, it could be many reasons, she might do it 4 times a year, 5 times a year. So a lot of time is lost. The opportunity of conceiving. Of course, once we work with them, they now fall into normal skin where they, ovulate almost every month. So you increase their window. They have so many more opportunities to conceive, and we support them through the pregnancy as well.
Everyone has, their own story, but it's the foundation for everyone is still the same. Having a body that's prepared, that's nourished, that's restored, that's ready to actually bring a life into the world. Thank you so much, Dr. Marina. If you're ready to take the next step, visit nationalwellnessgroup.com to learn how. Thank you again so much for joining us. We'll see you on the next episode as we continue our journey of healing from the inside out.